We're talking about a condition that can make you feel constantly stuffed up, tired, and unable to smell. It's chronic rhinosinusitis with nasal polyps, or CRSwNP. We'll explain what's really going on inside your nose and sinuses, why inflammation plays such a big role, and how to know when it's time to see a specialist. This podcast is made in partnership with the Allergy and Asthma Network. We want to thank AstraZeneca for sponsoring today's episode. While they support the show, all opinions are our own and sponsorship doesn't influence our content or editorial decisions. Any mentions of brands is for informational purposes only and not an endorsement. Now let's get to it. You're listening to The Itch, a podcast exploring all things allergy, asthma, and immunology.
Today we have a good friend, Dr. Rohit Katial, on, and we are going to be discussing chronic rhinosinusitis with nasal polyps. Rohit, can you tell our audience a little bit about yourself?
Yes, I'm an allergist immunologist, and I am in Denver, Colorado at National Jewish Health, and been here quite some time, and particularly interested in disease of the nose, sinus, and lungs.
Great. So you're the perfect person to help us understand this condition. We've done a quick episode on this topic when we went through the Waypoint trial with our audience, but today we're really going to dig deep and understand exactly what this condition is. So could you break down what chronic rhinosinusitis with nasal polyps exactly means?
It is a lot of words, so it can be very confusing, but let's break it down. So the first word is chronic, as you mentioned, and that just refers to how long the symptoms have been around. And in medical literature, frequently they'll use 12 weeks as a cutoff point, and anything beyond that, if symptoms are persisting, we say chronic. So that's the first word. Then the next long, rhinosinusitis, let's break that into pieces if we can. Rhino just refers to the nose, so we're talking about chronic symptoms of the nose. Sinusitis now is inflammation. Any itis generally refers to inflammation. So sinusitis is inflammation of the sinuses, really more specifically the lining and the tissue of the sinuses. And then the final piece of that is nasal polyps. These are, I tell patients frequently, they're like grapes. They're inflammation or swelling of that lining that I just referred to, and then it fills with fluid and it forms these little sacs that look like grapes, if you will, for sake of a better visual. So that's what the nasal polyps are. They're not polyps as we frequently might hear about in stomachs or colons or GI tracts. These are really sacs of lots of fluid and inflammation. So chronic rhinosinusitis with nasal polyps is chronic symptoms of the nose, specifically the sinuses, and the inflammation so much that you get these inflamed sacs.
Thank you so much for that explanation. I think that's actually very clear now. I have two questions for you. The first one is, how big are these nasal polyps? Because I'm thinking that grapes sound quite large. And the second thing is, I have recently realized that I didn't really understand what nasal passage, sinuses, I don't really know the whole anatomy of the face. Can we talk about that a little bit more? Because I was quite shocked to learn more about it, actually.
First, let me clarify the size question. They can be anywhere from relatively very small to medium. It's hard to put numbers to it, but the point is when a healthcare provider looks in the nose, they can see these greenish looking, grape shaped, if you will. Probably the shape's more important than visualizing their huge, large grape. So anywhere from small to medium, and they can occur on both sides. And if it goes unchecked, they'll continue to grow and they'll continue to increase not only in size but number. And so it fills and blocks both sides. To your second question, so the nose itself is really two channels for airflow that connects to the bones and the bony structure of the face. And within the bones of the face are these air pockets or air-filled spaces. And that's to add some maybe resonance to the voice and humidification. And there's all sorts of theories of what the purpose or function is. But those air spaces are what we refer to as the sinuses. And so this inflamed tissue is in both places. and the two channels, left and right side, that we breathe through in our nose, as well as these air pockets. So both of those areas can get filled. And as you can imagine, if they're filled with the swollen tissue in these sacs, you're going to get a blockage of airflow and feel like you're congested and full.
Yeah, absolutely. And I think for context, I've seen nasal polyps that can look like the size of a pea or the size of like two peas combined, you know? So I think essentially, if you think about that in your nose, just putting peas up your nose, you would not be able to breathe. And that's really the whole point. And they look gelatinous, just like grapes. And so I think that that's really a good analogy because they really do look like that gummy, gelatinous texture of grapes when you're looking at them.
That's a good way to think about size is peas and consistency, maybe the grapes. So those two together, I think, make a nice complement to each other.
Yes.
So we understand now where these nasal polyps are in the face. How do they actually form? Like, why are people getting them?
So the best thoughts around that question are the following. Your immune system, think about it as overreacting or kind of being turned on all the time. And as a result, as I mentioned, it's inflammation. That's what that itis is that we just talked about in sinusitis. That inflammation, what is it? It's all these cells in our body that are going to the nose, and it's unclear why they're all going there, but they're going there, and they're also going into the sinuses. And those cells then are releasing other chemicals that then promote further inflammation in those areas in the sinuses as well as within those channels in the nose. And particularly three chemicals, and I won't get too technical, but they're frequently abbreviated, the three chemicals that are really important in this space. And they're important because now we potentially have medicines as well that target these chemicals. Those chemicals abbreviated are something called IL-4, IL-5, and IL-13. You can think of that as maybe fuel for these cells to really juice them up even more. And that combination of these cells going to the nose and sinuses and then releasing these chemicals, further amplifying that inflammation, then leads to what we just described as those inflamed and sac-like appearance of the tissue and all that fluid in there and blockage so you can't breathe and you feel full and congested. That's really what's driving the polyps in kind of a simple sense.
We've actually talked a lot about IL-4, IL-5, and IL-13 in the context of many different conditions. And so now they're coming back here and we've talked about them. And I liked your analogy of they're adding fuel to the fire. We've talked about them in different analogies in other episodes, which we'll definitely link to in this episode. But essentially, the immune system is overreacting. And when those mediators are being released for no reason, then we get too much swelling, as you mentioned, and that leads to problems all over the body. And in this situation, what we're talking about is inflammation or swelling in the nasal passages and the sinuses where we're meant to breathe from. Now, the next question that we really have is why do some people develop polyps while others don't?
Yeah, so we don't know the exact answer to that. We assume there's potentially a genetic component, but also we don't know clearly what turns the system on. As you just mentioned, it's an exaggerated or hyper response of the immune system, but what turns it on? It's not fully understood at this time what turns it on, but we know very clearly and absolutely that it gets turned on, as you mentioned, and we get these high levels of interleukin 4, 5, and 13. And then the result, obviously, of that is what we've talked about, not only blockage, but that lining then becomes very leaky in both directions, meaning fluid leaks out into the nose and into the sinuses. But then things we're always breathing and inhaling, all those allergens and potentially infectious things can go in through that leaky lining. So that lining also is a little bit of a defense for us. So when it's not working right or it's swollen, things are going to go both directions in and out from there. But your question of why do some people get it and why some don't, we just know that it's turned on hyperreactive immune system, but why it got turned on in some people, maybe some genetics, but we don't fully understand that.
It just randomly happens. Like, there's not like something like in your life.
This happens. People will come and say, "Hey, I was great. Felt like I got a cold, and it's a cold that never went away." And that's when we start asking more questions and thinking about, did something get turned on that's not shutting down?
Are there environmental or biological factors that would increase your risk of developing chronic rhinosinusitis with nasal polyps?
So many things and numerous exposures can give you swelling and inflammation in the sinuses. They're not the direct cause of these polyps, as we just discussed, since we don't really know what turns it on, but they can aggravate what's already an aggravated nose and an aggravated sinus. So let's say this gets turned on, you start developing polyps and sinus disease, and you're an allergic person to grasses and weeds and all the common exposures. Now you inhale those allergens as you're breathing, and that just makes a swollen situation even much worse. Same with infections. You're already congested, you're already blocked, and now you get a viral infection that's going around. That's going to make it worse. It's not the underlying cause. And then there's a slightly more rare situation where people can have this sinus swelling and disease and polyps and have asthma. And when they ingest pain meds like aspirin or naproxen, ibuprofen, they can have a reaction in their breathing respiratory tract, in both the sinuses and in the lungs, an asthma like reaction or super duper congestion in the nose when they take these pain meds. And that's kind of a more rare and unusual association between this type of sinus and asthma and these medications. But outside of that, it's really, again, we don't know what causes this chronic rhinosinusitis with nasal polyps, but all of these other exposures can definitely aggravate what's already a bad situation.
Yeah, and even things like smoking or occupational irritants can worsen the inflammation and symptoms. So, if you do have a condition like chronic rhinosinusitis with nasal polyps or CRS with nasal polyps, then, you want to refrain from smoking because that's only going to exacerbate your symptoms. And we also want to properly treat allergens, right? So, if you do have this condition, we usually do test for allergens and see if that is something else that's affecting your nasal passages and something that we may be able to control for and help. And then, as far as the other condition that Dr. Katial mentioned, that's also called aspirin exacerbated respiratory disease. And it's known as something called Samter's triad. So you might read about that. And again, it involves three main things: asthma, then chronic sinus disease with nasal polyps, which is what we're talking about today. And then again, the third thing is reactions to aspirin or other what we call non-steroidal anti-inflammatory medications like ibuprofen or naproxen. So if you've had a reaction to those medications, you have asthma, and then you have a plugged up nose, you may be dealing with a condition like that. But that's something that a specialist like an allergist would be able to help you diagnose. And so that's just something else to keep in mind.
Do you mind, Dr. G, if we pause here really quickly and just review everything? This is like the first time we've really talked about it, and I just want to make sure that I'm understanding everything. So, chronic rhinosinusitis with nasal polyps is something that lasts for 12 weeks or longer, and it happens in your nasal passage and in your sinuses. So, like in the part of your face, like your cheeks, right, and your nose. And they're like these little things that are pea-ish sized, but gelatinous like a grape. And when a doctor looks up your nose, they can see them and they're blocking your breathing. The other thing is that they're very irritated. So, like, you have this mucus lining in your nose and in your nasal passages, and that gets really, really inflamed and irritated. Because it gets inflamed and irritated, it also gets leaky. So, maybe does that mean that your nose is running more often? But also that when you breathe things in, like pollen or other irritants, it causes that to get even more inflamed. So it's kind of like this nasty cycle of you're breathing out, stuff is coming out, you're breathing in, stuff is coming in, and that's making it worse. So that's basically what I'm understanding is what's going on in the face. And then we don't really know exactly what brings it on. There might be genetic components, but we do know that it's involving the immune system. So there are certain things called interleukins, which I am very pleased to know this word now on this podcast, but there are certain chemicals that make these polyps happen. And so it's basically something in the immune system that's causing these polyps, not something specifically that you're doing or eating or breathing. That's kind of the gist.
That was a nice summary. Well done.
Yes, Kortney's a master at creating summaries off of things that she's just learned. So it's really impressive. And the only other thing that I'd like to mention is that sometimes we can't see them by just looking up your nose, and we might do something called a CT scan of your sinuses to really be able to see how far into your sinuses the polyps are growing and how much growth you have and which side might be affected more than the other. And that can help play a role in determining what kind of treatment you might need. That's just something else that we haven't really talked about that I wanted to mention as I was listening to your great summary.
Thank you, Dr. G, for letting us know that you don't always see those little pee thingies in your nose. So that's important to note that if you are feeling congested and you're like trying to look it up, you might not see it. So that's why we always want to go to the doctor and make sure we're not self-diagnosing with ChatGPT. But the one question I did have, because I know this term interleukin because of the episodes we did on type 2 inflammation. And is this also what's going on with chronic rhinosinusitis with nasal polyps?
As I mentioned in the very beginning, many cells are coming into the tissues of the nose and sinus, and these cells have names such as eosinophils, and there's mast cells there, mast, like a sail, and lymphocytes, which you might have heard of, and there's a particular type of lymphocyte called a Th2 lymphocyte. And so therefore, when we're talking about this type of inflammation, we frequently just use the simplified term of type 2 inflammation, and it encompasses all of these interleukins that you just nicely referred to. So these multiple cells are there releasing these interleukins, and that's all type 2 inflammation. And we've learned this over the years, and in our own research that I've done over the years, we can measure these both in the blood and sinuses, and we can measure these cells. So it's nice, comes together nicely.
Thank you. So we talked a little bit about the leaky nose and the congestion, but can we talk more about what the experience of having nasal polyps is? So what is happening inside of the sinuses and how are the patients coming to you eventually? Like, how do they know that it's not just a cold that's been around for 12 weeks?
Right. So one thing we didn't talk about is, and that's very, very important, is due to this blockage and all this inflammation, the part of the nose that has a function that's very important is smell. And because the blockage and the swelling, frequently patients will first lose their sense of smell. They don't think about it, but suddenly they can't taste their food and they're not able to smell noxious odors, which could be good or bad. Sometimes it can help you if there's a bad gas that you need to get away from, for example. So not only can they not breathe because they're all swollen and blocked up, but they can't smell. And then that affects taste because smell and taste are linked together. And then, as you mentioned earlier, there's all this drainage. So not only is you're blowing your nose all the time, but stuff's dripping back, so you feel it in your throat, and it's just really a miserable quality of life because you can't breathe, and you can't smell, and you can't adequately taste. So that really, really impacts patients in multiple ways.
Do they also have like a severe pressure on their face? Because I'm thinking of when I've had a sinus cold and I just feel like my face is going to explode. Is that an experience that they also have?
It definitely can, especially the longer this goes unchecked, the more swelling, the bigger these polyps get. They start feeling more pressure. You can get headaches. Not only can't you breathe, not only can't you smell and taste, but your face hurts. And you can imagine that's not very pleasant. Then you don't sleep well. And if you don't sleep well, then you're tired during the day and you're not as productive. So you can see it's the cycle that just continues to impact individuals in multiple ways.
Yes, it's actually very, very debilitating. And people come in once they've been to several specialists sometimes. And usually it's the ear, nose, and throat doctor that ultimately determines and looks into the nose with a scope and is able to see the nasal polyps if they're further in. Once we determine that they have nasal polyps, I'd mentioned that allergy testing can be helpful because there's a lot of overlap, right? So about 40 to 60% of people with chronic rhinosinusitis with nasal polyps also have asthma and allergies. And so they share that same type 2 inflammatory pathway. Oftentimes, again, these conditions kind of overlap. And so we need to be aware of that because sometimes the same medications that are used to treat one condition can also help treat another condition. So once we realize that there's that commonality, we can help patients in different ways with the management.
I have had the privilege of hearing about someone's experience living with chronic rhinosinusitis with nasal polyps. And like you mentioned, Dr. G, she went to multiple specialists to figure out what was going on. And it was really hard for her to get an answer. So if someone's listening to this and kind of thinking maybe this is me, so what are some signs and symptoms that a patient can leave with to know that, okay, this is what's going on inside of me?
So my answer to that would be smell is one. People with straightforward allergies, congestion and runny nose from allergies only generally can smell. But this kind of intense type 2 inflammation, as I mentioned, can affect the apparatus in the nose that's responsible for smell. So that's if one had to ask one question, it's smell. Then, oh, I had a cold or I developed something and it's just gone on and on. That's why the word chronic's there. So that's really important. This is not going away. I think that requires an evaluation as well. So those are two really clear features. And then if suddenly you didn't have asthma, but you're also coughing and you're short of breath and chest tightness, that's also a clue that maybe, as was just mentioned, these two can coexist, the asthma and the CRS with nasal polyps. And so suddenly if you're starting to get symptoms down below in your lungs, coughing, and again, short of breath. That also is a clue. So smell, congestion that's chronic, and breathing issues.
And as we've said so many times on this podcast, if you are confused about your symptoms, if you're buying every single medication that's available for congestion in the drugstore and you're still not getting relief, it's really time to get evaluated and see what else might be going on. Because as Dr. Katial mentioned, the longer the swelling or inflammation persists, the harder it is for us to help reduce those symptoms quickly. And so it's really important to take care of inflammation and swelling early rather than later. And so seeing a specialist can be very helpful. And that specialist can be an ear, nose, and throat doctor, can be an allergist. And I think those are the two types of doctors I would start with. And then you may end up seeing both at some point.
Thank you so much, Dr. G. Thank you so much, Dr. Katial, for sharing what patients should look out for if they're concerned about having CRS with nasal polyps. I know that I want to ask you 1,000 more questions now, like how do you diagnose them? How do you treat them? But that is coming because we just attacked the what is, and I think that's enough for now. So thank you so much, and I'm looking really forward to having more conversations about what's out there and how people get diagnosed.
It was a pleasure. Thanks for having me. Enjoyed the conversation.
Thanks, Rohit.
Thank you for listening to today's episode. Remember that all information you hear today is for informational purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. And also, don't forget to subscribe to our podcast. And if you have a second, help spread the word by rating our podcast and sharing with your friends and family who might also be interested in learning more about allergies, asthma, and immunology. You can always stay up to date by checking out our Instagram, The Itch Podcast, where you can leave questions you are itching to know, or check out our website, which is www.itchpodcast.com, which contains more information about the subjects we covered in today's episode and every episode. Until next time, have a fabulous week.